Guys, Stalker Free here. So I started a new series called Grown Up Life Sucks last time, and I'm going to continue that series. So here's another episode of Grown Up Life Sucks. Woo! Episode 2. And today we're going to be talking about workers' comp again. So my injury, for those of you who didn't see video 1, was on August 4th of 2015. And here is a little bit of an update. So, within a week of my injury, I was referred to go to physical therapy. Workers' comp denied it. They denied to pay for it. So I couldn't go. So I've also been out of work since August 4th of 2015. And I also didn't get paid by workers' comp for over 2 months. 2 months. I got 2 kids. I've got a disabled fiance. And I've got 10 pets in-house. So you can imagine how not stressful this has been. So I finally got into physical therapy. My first appointment was on Tuesday of this week. We are in December, almost to Christmas. And the reason why I got into physical therapy was my pain management specialist wanted to give me a nerve block injection because I still can't curl my toes, let alone lift things, let alone do almost anything that involves my lower back or my right leg. And I'm still having to deal with being on a cane. I hate that thing. Trying to get off of it. So, yeah. So my physical therapist, through examination of hell, because what she did was, I want you to push yourself through the pain because I need to know how much you can do now. So I was sitting there bawling my eyes out. No joke. I wish it was. I'm not the crying type. This shit hurt. And she said it was required so that she could know what I could do despite my pain. So, end result was my injury is permanent. And on February 12th of next year, I will be sitting down in my attorney's office with somebody from Workers' Comp as a representative from the Workers' Comp insurance company that I've been dealing with, which, they're lovely. So I'm sure it's going to go well. But basically, they're trying to keep it out of court, so it's probably going to wind up ending in a settlement, which, whatever, it'd be great to get off workers' comp, because maybe I could actually get the treatment I need then, rather than having to fight somebody for as long as I've had to fight just to get it something as far as physical therapy. Okay, I don't want you to throw a bunch of medications at me. I just want to get better. So, it's irritating. And then they didn't pay me for over 2 months. So, that's just awesome. And they weren't giving me any treatment. All I still had was my pain management specialist. That was it. Since August. Oh, I went to some doctor's appointments in August. And then that's been it. And every time I went, I didn't even have a consistent doctor. It was a new fucking doctor every single time. So you know what happened? I had to be re-examined every time. Let's flex you around. Bring your knee to your chest. What the hell are you trying to do? Worsen my injury? Break my body? Okay? For reals. I've got no shame in my age. So I'm 26. I'm turning 27 in January. But I'm on a fucking cane. I've been on a cane since fucking August. I didn't need any walking devices before this injury. At all. Do you have any idea how fucking self-defeating this shit is? And it's real, man. I can't do half the shit with my kids that I used to. I can't do half the shit with my fiance that I used to. Like the random adventures and stuff that I used to take her on. I can't fucking do. Oh, and get this, right? This is a big thing to admit, knowing that it's going up. So here goes nothing. I'm going to trust you guys with this, alright? I'm a sexual abuse survivor diagnosed for PTSD, insomnia, and I got diagnosed for depression through it. I'm on no meds for it. Okay? I learned self-coping mechanisms, stuff that worked for me, and everybody works different. So if you have any of these things and you're on meds and it's working for you, I'm so happy for you. I wish it could have been easier on me than it turned out to be. So my preference for a care provider, and not trying to be sexist, but my preference for a care provider due to this abuse is to have a female care provider. Workers' comp gave me a hard time for it. They were just like, oh, can't you just see a male? The first attorney I talked to said the same fucking thing. So, like, really? And then even my employer said the same thing. They were like, oh, well, I know that you're gay and all, but can't you just see a male anyways? Has nothing to do with my sexual preference in a partner. Nothing. Somehow, all of this has slipped under the fucking radar. I don't know how the fuck they've done it so far, but it's bullshit. So, finally got into physical therapy. My physical therapist's thoughts on the matter are that I have a herniated disc that has slipped into my sciatic nerve, which is why I can't curl my toes or anything. And she says it's quite significant. And that generally, if injuries like this were going to heal, it would have happened in the first 6 weeks. Within a week of my injury, I was referred to physical therapy and workers' comp denied it. And my physical therapist let me know that at this point, given the state of my injury and the way that it has progressed, because I even have upper back pain now in between my shoulders all the time, and I asked her if that's normal, and she said it is because your body goes into defense mode and tries to protect itself. Her thoughts on the matter of me getting better is it's not going to. Because I wasn't in physical therapy soon enough, I wasn't seen soon enough, and so my body's done what it's done as its way of healing however it can. So this is it. This is fucking it. Thank you, workers' comp. Wanted to live my life fucking disabled. I went and got a college degree so that I could not be able to even use it. Who wants to utilize their degree? No, I'd rather just get one to do absolutely nothing with it. So, here's the deal. Said I need to look out for things like foot drop, loss of bladder control, which I was like, I ain't wearing no Depends. I'm 26, turning 27 January. Like, yeah, be shitting me. I haven't lost my bladder control so far, and I don't plan on doing it anytime soon. And the numbness you get in your leg, if that's all you have and you lose your burning, stabbing pain in your leg, then that's a bad sign. Foot drop. I can have fucking foot drop. So she let me know if I get any of these symptoms, I need to go to an ER right away because I will need emergency back surgery. And, you know, if that surgery happens to have anything go wrong, I don't even want to think about that, but if it does, it wouldn't be good. And she let me know if I choose to ignore any of these things, if I get them, and not go to an ER, then I can be wheelchair bound. I don't live in a place that would be good for a wheelchair. Okay, I live in the fucking mountains. I don't have a wheelchair fucking ramp around here. I have dirt and rocks in my front yard. You know, this room that I'm recording in now, you have to go down a set of stairs to get to it. There's no fucking ramp. And the stairs only have little wood steps, and in front of that is fucking mud and dirt. What do you want me to do? Fucking skyrocket myself down the stairs and try to do a 360 turn in it like it's a motherfucking skateboard on ground that wouldn't even be made for a skateboard in order to make the sharp pivot turn to get into this room? I barely pull it off with a cane. You gotta be out of your freaking mind. So this is my life right now. The only good thing that happened is that workers' comp finally paid me for all the time they didn't, because it's almost Christmas, so at least I can get my kids something for fucking Christmas. And my partner. And at least I can get the animals some extra fucking food, and I can get some extra fucking flea treatment, and I can afford to go to all my appointments because they haven't paid me for any of the gas, even though they get all the reports of my appointments, so they know that I'm going and what I'm going to. And they are legally supposed to pay you for the gas spent. So this is my life right now. This is seriously my life. I've got no idea where to go next. I've got no idea how February 12th at 2 p.m. when I go to meet with them is going to go. And I don't want to be on permanent disability. But it's looking like I'm running into no other options. And I have no way of knowing if disability is even going to accept me. I mean, workers' comp's been so fucking fun. No idea how a disability case would go. Most people get denied their first time, and it can take like a year or more for them to even get to you because of the waiting list. Fucking sucks. It sucks. And it is what it is. This is just what it fucking is. And that sucks. It sucks so fucking bad. It'd be bad enough if I only had myself to support. But I have a fucking family to support. And being injured became a punishment for me. I can't support them right now. And that is a shitty reality. So, I'm certified for a number of things. I'm a certified caregiver. I even did volunteer teaching for caregiving for a class to help them pass the Red State Cross exam. Nobody flunked when I taught that class. 2 people flunked when I had taken the class as a student. 2 people flunked the Red Cross State exam. I taught the very next class that came in after mine. Nobody flunked, and I take damn good pride in that. I earned that. I got hired to take care of a father-in-law for the vice principal of the school I went to, which I'm not going to tell you the name because that would be giving out confidential information on who that person was. And, I was working 16 hours. 7 days a week. Then it became 6 because I was fucking tired. And then I got hired at the same place I did my clinicals. And the assisted living side. And around my work schedule, I would run over to the skilled nursing side of the building where I had done my clinicals to work with this class on grounds with live residents. Then I also went to the school to work with them in the classroom and practice with the mannequins, play as a patient for them. I played as a stubborn pain in the butt patient just so I could make sure they had the patience for this job. Because good care is just good care. Shitty care is shitty care, and it blows up the wazoo. There are not enough people who seriously care about the patients anymore, so I put them to the test. Because healthcare is supposed to be about caring and treating every patient as if they were your own fucking family member that was there. And keeping in mind that they require patience because you may run into some that have extreme amounts of pain. And when you're in pain, I'm sure you're not always peachy to be around. So take that into consideration when working with a patient. I'm certified for home health care. I took care of my own grandmother and my mother through their surgeries. And I rehabbed my grandmother back to a 3-flight story apartment and got her to her 80th birthday when nobody thought she was going to make it. Got her through an extensive blood clot that went from just above her toes, halfway up her pelvic bone. Got her through 4 stents being in place, 2 collapsing, a massive heart attack. She had a mild heart attack before the stents. Massive heart attack, CHF, fractured tailbone, and quadruple bypass surgery. She now walks up 3 flights of stairs with no walking support. She went from a walker to a cane to back on her own 2 feet. And I am damn proud of her because she fought real hard to get there. So, mind you, she's also diabetic and osteoporosis. So nobody thought she was going to make it through. And you know what? She proved them wrong. So one can only hope at a time like this that I take after her. Because then I'm pretty sure I could get back on my own 2 feet and defeat the odds too. Hell, I did it before. I had grand mal seizures and went through a lot of crap with that. And you know what? I came out better than most people I know that had a history of it and got better, and people I know who still have it. It's a fucking hard thing to have quality of life with. That's for sure. Grand mal epileptic seizures are hard. So, I'm certified for that. I'm certified for security guard. I'm certified for a number of different things with computers that I got through my schooling. I'm certified for HIPAA guidelines. I'm certified, like, for the knowledge of HIPAA guidelines, not for, whatever. You get it. I have a degree in medical assisting. I have, first aid certification. I have CPR training with AED machines. I'm probably forgetting some. I have a lot of shit. And now, with this injury, I'm not sure what I'm supposed to do with it. I can't sit for fucking 8 hours. It hurts like a bitch to even try to sit for an hour, which I'm being forced to do to get some of the appointments because I don't live close enough to the things that accept my insurance. And I don't live close enough to the things that workers' comp stuff accepts either. So it's been a difficult journey to say the least. But yeah, any of you who have dealt with workers' comp, tell me about your experience, man, because I could just use some time outside of myself and hear somebody else say, yeah, that shit sucks and this is why it sucked for me. And if you haven't dealt with it, comment anyways. Or, give me a comment about something else you'd like to hear me talk about for this series. If you want to hear me talk about parenting, dude, let's do it. I've got kids that are polar opposites, and they're fucking amazing individuals. And I love how much they own exactly who they are. Got a 9-year-old and a 12-year-old. 9-year-old daughter and a 12-year-old son. And I couldn't be prouder of the people that they're becoming. Because the people they are becoming is completely true to themselves. And they don't let anybody tell them to be somebody else. And you know why? Because they know that they are awesome. If you want to hear me talk about relationships and maintenance to those, I can do that. Dude, I've been in every kind of relationship there is, and I am so glad, so fucking glad, can't stress it enough, to have wound up in the one that I did, because she is fucking perfect. She is my perfect 10. And she could do anything, throw me under a bus, and you know what? She'd still be my perfect 10. She would never do that, but even if she did, I love that woman with all that I am. And also, if you didn't see the first video, I do own up to being a genderqueer. You got a problem with that, whatever. But 10 to 1, you're going to love what I have to say anyways, because me being genderqueer or me having a female partner when I'm a female doesn't change the fact that underneath it all, we're not any fucking different. You know why? Because we're all people, and we're all going to have preferences, and we're all going to have opinions. And if yours is different from mine, that's fine. I can respect that. As long as you can respect mine. So, and me being genderqueer or gay doesn't mean I'm stupid. I've got a lot to say, and I've got an education under my belt. So, it's up to you. But if it bothers you, don't watch. There's plenty of other shit to watch on the internet. There's fucking everything on the internet. And I swear like a sailor, and I'm sorry if that bothers you too. But I am who I am, and I own up to that. So, I'm a parent. The kids call me daddy. I am the adopted dad. You know what? You don't have to be biological to be a father. And you don't even have to be a male for them to consider you a father. All you have to do is care about them and teach them to be true to themselves. It's really not that hard. So, and I'm a pet mommy. I own a fucking crazy cat who knocks everything over all the time and likes to meow and is very vocal, and I love her to death, even though she also makes me want to rip out my hair and drives me crazy. But you know what? I've had her since I was 15. We got 2 cats, 3 dogs, a rat, a mouse, 2 snakes, a turtle. Feel like I might be forgetting something. Oh, a fish. We got a fish too. So we got a lot. And you know what? That's pretty fucking awesome. So, yeah. I have a good life despite everything else that's going on in it. I'm grateful to have what I have. I understand that I have more than most people do, and even with everything, I'm lucky. But as far as I can see it with my workers' comp situation, can't get any worse than it is, so it's got nowhere to go but up, right? So, holding on to that positive note. Let me know how you all are doing. Tell me your stories if you got them, because I want to hear them. Love you guys, and keep watching.